obviously we've talked all about how this study is featuring APOE4 carriers, which everybody knows within the space is a significant increased risk for Alzheimer's disease. So talk a little bit about the significance and uniqueness, honestly, of this study and what it's trying to do here.
Great point. So, our idea was if we find good results in the phase 2 study, then it would give us a very solid rationale to actually expand our studies from just homozygotes, who are about 15% of all AD patients, to carriers, meaning homo and heterozygotes. Then you cover 65 to 70% of all AD. So it's the majority of the population. And of course, that's good because they also require good treatment. And you probably know the APOE4 carriers are the population that's at somewhat increased risk of vasogenic edema or the complications with amyloid immunotherapy with antibodies. So it was really important to expand the population. So the way we interpret the data is that everything is very consistent from our current data to the previous data with the old formulation, which is important to show reproducibility. The other thing is that all the outcomes we saw fit together very well with our basic mechanism of action, which is the following. You're able to inhibit the formation of the soluble amyloid oligomers, which are actually the most toxic species. By that, we're able to reduce p-tau early and significantly and are robust because, it's not enough to just have any p-tau reduction. Even if it's significant at 10%, it may not be meaningful. We have multiples of that. So 41% is a large effect, starts early and is consistent over a year. That's an important point because, AD patients over a year can decline quite a bit. So we think of it as a race between our drug effect and the natural history of the disease. If you wait a year or a year and a half to achieve efficacious concentrations, like with some of the antibodies, this disease is already progressing. It may be harder to show benefit. In contrast, we have efficacy probably on the biomarkers as early as 3 months. And indeed, at the 6-month and 12-month endpoint, we actually show significant benefits on cognition in this study, which replicates the old placebo-controlled data. And because I think we have robust effects on these biomarkers, we are able to change brain volume. So that's really changing brain structure, which is what we call disease modification. You're able to change the core pathologies of the disease, amyloid and phospho-tau, and able to show preservation of hippocampal volume and cognitive benefit.